Good morning. Can everybody hear me?
Good morning. There
Good
we
morning.
go.
Good morning. So my name is Dr. Britt Weinstock, and I welcome everyone to this session. It's called The Devastating Effects of the Social Determinants of Health and its Impact on Community During COVID-19 Pandemic. I'm so pleased and honored to be joined by 5 excellent panelists. Thank you so much for taking so much time out of your busy days to be with us. And this is such an important topic, and I really am so thankful that all of you are here to give and share your expertise from your various perspectives on this very pressing issue. As you all know, we only have 1 hour and we have a lot of ground to cover. So I would like to refer everybody to the bio sketches that are attached and please do read them because we've got a lot of brain power right now on this particular session. We have with us today Gita Rampersad from Beating America. There you go. Dr. Kenneth Bridges from Global Blood Therapeutics. Morning, gentlemen. Only gentlemen on the panel. Dr. Destiny-Simone Ramjohn from BlueCross, BlueShield, CareFirst. Ms. Vikki Walton from Novartis. And we have Portia Reddick White from Campaign for Tobacco-Free Kids. So thank you so much for joining us. I'm just going to dive right in. So I'm going to throw out the first question. I'm going to start with Ms. Rampersad to answer, but this goes to everybody. If each of you would take a couple of minutes to speak about the work that you are undertaking currently to address the negative consequences of the social determinants of health that have had a disproportionate impact on communities of color during the COVID-19 pandemic.
Well, thank you, Britt, for having me today. I'm really thrilled to be a part of this conversation. As you know, I represent Feeding America. I'm the Vice President for Health and Nutrition. And so I guess it's pretty evident that the social determinant that we're addressing is food security. We have seen hunger explode in the United States as a result of COVID-19. I think when we watch TV, we often see the lines for food banks stretching for miles, coupled with hospitals that are overwhelmed with COVID patients. So we've gone on this journey hand in hand, I think. And before the pandemic, we were actually seeing rates of food insecurity decline, and actually they were at their lowest rates since the last recession in 2008. We estimated there were about 35 million people who didn't have enough food to feed their families. And as of 2020, when the pandemic hit, that number rose to closer to 50 million. And right now we estimate that we're somewhere around 45 million. So we've definitely seen a jump. Before the pandemic, really the 35 million kind of translated to 1 in 9 people and 1 in 6 kids. Now we're looking at 1 in 7 people and 1 in 4 children that are facing hunger. So, that speaks for itself that we are in a hunger crisis here as a result of this pandemic. But we've also seen new trends. Our food banks have estimated about a 60% jump in demand. We've also seen that about 40% of the people that are visiting our food banks and our pantries have never sought help from the charitable food system before. So this is an interesting change, and it also means that we have to start to make adjustments and adapt some of our models to be able to accommodate people who just don't know how to navigate the system. We've seen disproportionate impacts similarly to the pandemic on Blacks, Latinos, Native Americans, and rural communities. In fact, in some rural communities, there's 1 in 2 kids that are probably facing hunger. So it's the even more dire situation. And we estimate 1 in 5 Blacks were facing hunger prior to the pandemic, and that was about 20%. Now we think it's closer to 25%. So that's a pretty big leap for a year. But overall, we've had to adapt and sort of come up with these solutions that were intended for the short term, but we know that COVID-19 is not going away in the short term. So we've adapted our operating models to meet people where they are. We've made a commitment to equity, which includes race, health, food, opportunity. And we're also promoting stronger partnerships with the health and healthcare sectors.
Great, thank you so much. Dr. Bridges?
Oh, thank you very much, Britt. I'm talking a little bit about sickle cell disease today, but I want you to make no mistake, this is a problem that spans the whole aspect of healthcare for Black and underrepresented Americans. So this is just a model that I'm talking about, that if you're talking about diabetes, talking about heart disease, story is the same. The key issue is access to care. This has been a problem even before the COVID-19 pandemic began. Access to care for people with sickle cell disease was far below what one would either hope or expect. Of people in the United States, only 20% see a hematologist in a given year. Now, what disorder, serious disorder, would you say that only 20% of people would see a specialist in a given year? That's lack of access. The issue that has now, we found with COVID-19, is it's made it even worse. People cannot get into the clinics. They're rightly fearful of the possibility of contracting this terrible disease. So access to care is the key. We are at GBT working, we've had a couple of access to care summits in the past, but more importantly, we're beginning a program to address the shortcomings with respect to healthcare in America around sickle cell disease. But again, this is a model for everything else that you see. And it's very important that we press this forward in this very critical time.
Thank you. Thank you. Dr. Destiny-Simone Ramjohn?
Good morning, and so thrilled to be here. I am proud to serve as Vice President of Community Health and Social Impact with CareFirst. We are the largest health insurer in the Baltimore and DC region. And really, we have some of the best healthcare providers and hospitals in the world right here in the Mid-Atlantic states. But we're also home to some of the most tragic data when it comes to the social determinants of health, but also the downstream clinical conditions. For example, Black women are 3 times more likely to die from pregnancy-related causes than white women and have twice the morbidity than white women do. So part of what CareFirst, BlueCross, BlueShield, and 20 plans across the association have begun doing is first making a pledge to make meaningful change. We know that sort of downstream or one-offs are not the ecosystem approach that's going to transform the health of populations and the social needs driving those barriers. So first, we have made a pledge to act. We have begun taking tangible steps to put a stop to injustices in our communities and removing barriers to preventing equitable health, well-being, and safety for all. We also have begun to pledge to listen, to learn, and act. That means hosting community events and discussions to listen and understand what we can do to end systemic racism in our communities. And as we saw, COVID was not just a pandemic in and of itself, it was the twin pandemics of structural racism and social determinants, creating this really harmful ecosystem. I'll talk later in the program about some of the key investments that we've made, including community health and social impact partnering to distribute personal protective equipment, fund initiatives like educational opportunity, economic and workforce development, and more, so that communities can have a stable sort of basis from which to react to COVID.
Great, great. That's gonna be exciting. Ms. Vikki Walton, hi.
Yes, hi everyone. Thank you so much for having me on this panel and to have Novartis have an opportunity to talk about social determinants of health as well as health equity. And one of the things I wanted to mention first and foremost is that we have a commitment to health equity, which we know embodies the social determinants of health. And so it starts with one of our strategic imperatives and priorities, which is building trust in society. And so we aim first to hold ourselves to the highest ethical standards, and then be a part of the solution on pricing and access for medicines, and then also address many of the global health challenges, while also being responsible citizens where we operate. So this includes Novartis building out an health equity platform, and that embodies the social determinants of health as we work to ensure that marginalized populations have access to equity in healthcare, as Dr. Bridges indicated. And so the pharmaceutical industry, we have both challenges and opportunities to promote an inclusive, equitable, and high quality care delivery system, which we know has been challenged for a variety of populations. So for us, this includes advocating for access, as Dr. Bridges indicated, to affordable and comprehensive health insurance coverage, addressing inequities again with social determinants of health, which lead to health disparities. And then we talked a little bit about sickle cell disease as an example, a key example that there are vast disparities. And so Novartis has been in the forefront of education and awareness and leading in policy changes. We also want to ensure that biomedical and research support equity in development and evaluation of new medicines. And so we know that diversity and inclusion in clinical trials is becoming, it's discussed more and more. And I believe we actually, Novartis, will be on a panel again tomorrow to discuss and deep dive further into this conversation. We also recognize that health equity presents us with an opportunity to align with a vast range of stakeholders, advocating for policy changes and looking for ways to improve in health disparities, which, there were partners that we may have not aligned with before. We're all coming together as a result of the COVID pandemic and saying we need to do something differently. We need to make measurable changes. And we're very excited that we are now becoming a part of those conversations and looking for what those solutions may be. So it starts for us by making the commitment, which we have, and then advocating to address those policy changes. And then most importantly, aligning with key partners to get the work done. We have to get this work done. And I've been with Novartis for over 24 years, and I've worked in health equity and disparities in care for 10 years. And I have never seen the passion around so many different stakeholders coming together to say, let's get to work.
Great, thank you so much. And you nailed it. You're right. There's so much momentum on this issue, and I think that the partnership piece is so vital. Last but certainly not least, Ms. Portia Reddick-White.
Thank you for having me today. I'm really excited about this conversation and being on the panel. And thanks for leading it, Britt. Dr. Weinstein,
Right, Britt, it's fine. It's fine.
Okay, thank you. Well, we know each other, so I apologize if I stepped out of the box there. But what we need to do really in listening to everyone is to address these social determinants firmly and steadfastly in various ways. And I think we're all doing that through education, reaching out to the community, supporting policy change, raising awareness in every way that we can. One thing that we've seen at the Campaign for Tobacco-Free Kids, where I'm Vice President for Strategic Partnerships, is that the COVID-19 pandemic has really brought this to our edge even much more in a focused way. The CDC actually connected smoking and lung disease. They finally came out and said that in August. We had an inkling that it was connected. It makes sense, right? It's just common sense. But once they did that, that was even much more helpful in us guiding and leading in our outreach to the community in that way. Current evidence suggests that the severity of COVID-19 is higher among smokers, and there are a very large amount of African-American smokers specifically. We're very concerned about that. 85% of Black American smokers use menthol cigarettes compared to 29% of their white counterparts. And the greatest burden of disease and death, it actually comes from tobacco. I can go into some of the numbers a little bit later as we speak, but as it pertains to young people, right before the pandemic hit, we did see many young people vaping, using e-cigarette products. And the result of that was this pandemic brewing within that whole area as well. So what we're doing, we're trying to harness people power by ensuring policymakers hear from key tobacco control advocates and public health groups. We are working together with youth and parents and healthcare providers and educators and civil rights organizations to help elevate some of the stories and really highlight the tobacco industry's bad acts. the fact that they've been predatory in their marketing. And we want to counter these, some of these false claims that they have out there about potential negative impacts on prohibiting menthol, which, by the way, there's a decision that's due this week, actually, it's on the 29th. So we're excited about being a part of the community that continues to highlight and campaign on a local, state, as well as federal view on these goals and initiatives.
Great, thank you so much. So I'm going to circle back to the first young lady that I spoke to, and I wanted to throw out this question for you to answer. Gita, the issue of hunger and food insecurity has long been a major problem in the United States. As you know, you're the expert on this. And the issue has been exacerbated by COVID-19. I mean, every time we are on news, we see folks who are standing in line who can't access food. Would you agree that hunger and food insecurity are major health equity issues today? And what is Feeding America doing to address this health equity issue during these trying times?
Oh, absolutely, I agree. I've actually been hearing a lot of common themes here, and I think we're all kind of thinking alike, and it's nice to hear the alignment, because sometimes I think that in the health equity space that there's still so much fragmented and siloed approaches, but it's nice to hear us starting to speak the same language, so to say. Yes, you know, hunger and health go hand in hand, and my team's role is really to make that connection for our food banks, for our partners, and for our community. We are, you know, one of the messages that we channel is that food insecurity often leads to tough choices. Tough choices are examples of, you know, having to choose between putting food on your family's table and filling your prescription, you know, putting food on your family's table and being able to buy your bus pass to get to work. So when we see that these tough choices are made over and over, we then see, again, these coping behaviors. And the coping behaviors can often lead to poor health outcomes, either exacerbated chronic disease or actually, you know, the introduction of chronic disease to people who are already at risk. 66% of our households report that that there's a member living with heart disease and or hypertension, and 1 in 3 report a member living with diabetes. And all that to say that this does eventually tax the health system, the healthcare system. We've estimated that hunger can cost up to $2,000 extra per person, per patient, per year for the healthcare system. And if you add it up with the 50 million that we're facing hunger now, so that's a lot of money. And it's preventable. There are solutions that can prevent this. Nobody should be going hungry in this country. And I think the only way that we really are going to be able to find the solution is to actually lead with a health equity lens. And so that's what we're trying to do. We're trying to increase access by understanding who are the most vulnerable in our communities. We have service areas, food bank service areas, and we're designing heat maps to show where there are higher rates of chronic disease, higher people who have who are much more food insecure, who have to rely on the charitable food system more often, who have higher rates of smoking and other health behaviors. And when we're trying to kind of target that and bring in, you know, strategies to really make sure that those communities, those people are not left behind. We're also looking at culturally appropriate options. It's so important if you bring in food, if I get a food box and all the food in the food box is nothing I've ever seen or eaten before, chances are I'm going to contribute to food waste as opposed to, you know, really solving hunger. So we're being very mindful of this culturally appropriate approach to distribution. And I think we're really trying to shift the conversation from just making the connection between hunger and health to really being a part of influencing better health and well-being. So seeing really that outcomes shift where we play a part in the health and well-being of the communities that we serve by helping with chronic disease management and prevention, and also mental and emotional health. I mean, we know that people who are hungry are, you know, are often more prone to depression, suicide, and children have often experienced developmental delays, which then can lead to mental and emotional health challenges. So, you know, we've definitely focused on the equitable part, but we know that this is just you know, sort of the beginning of our journey. And unless I know that it's often said you have to embed equity in the work that you do. I don't necessarily agree with that. I don't think we've gotten there yet. I think we still need to put equity front and center before we can start to thread it through all of our work. There's still so much more to understand about this field.
Great, great, thank you. Dr. Bridges, you're up next. My question for you is, you know, would you share with everyone what Global Blood Therapeutics is doing to really address the negative impact of the social determinants of health that they have had and continue to have, especially in the sickle cell community during the COVID-19 pandemic? And what are some of the challenges that you're confronted or working to address as you move forward?
I think the challenges around the social determinants of health as they pertain to the COVID-19 pandemic are really an exacerbation of underlying inequity. The underlying inequity that has existed for 250 years or more has grown. And as we have said, the problem, healthcare is simply part of a spectrum. We have, as just mentioned, the food and providing food. We have smoking, which is a negative determinant. We have various other aspects, and this is part of a single continuum. And so I think that I want to emphasize to the audience that we're talking all about the same thing, different lenses on the same issue. What can we do? And we all have to take our portion of what we can do. We're trying to address part of this by having a program or facilitating programs that emphasize the access of patients to health care. As I mentioned, one of the issues is people with sickle cell disease, as with many other chronic disorders, require specialized knowledge, specialized care, and specialized facilities. We are moving forward with an initiative to make these available, not just at centers in the major cities, but making these available much more broadly throughout the country. We have had activities around this done by, for instance, HRSA, the so-called demonstration projects, demonstrating that these approaches work. Well, it's now time to take those demonstrations and put them to work for everybody. So this is one of our major initiatives that we're moving forward this year to try and move the needle with respect to the care, and I mean broadly, not just sickle cell, but broadly the care of people in this country who are affected by systemic racism and inequity.
Great, great. Thank you for that. My next question is for, Dr. Destiny-Simone Ramjohn from CareFirst, BlueCross, BlueShield. Dr. Ramjohn, as you well know, BlueCross, BlueShield is a major player in the coverage space. CareFirst is so well positioned to leverage its influence on enrollees and providers to monitor, measure, and reduce the impact of the social determinants of health that give rise to countless health inequities and inequalities. Would you share with everyone some of the initiatives that your company has launched, the impact, and your company's vision moving forward?
Sure. So I want to go back to kind of the early days of COVID, and when it became clear that the situation would escalate, we immediately formed a task force reporting directly to our company's president and CEO, Brian Pinnock, as well as our executive leadership team. Brian's an amazing leader. He's among the most forward-thinking executives in healthcare. And I think that comprehensive response is one that I'm especially proud of. So that meant that we were thinking not just as a sort of our business imperatives, but really the health and safety of our workforce, the business continuity and uninterrupted service to our customers, removing barriers to care for our members, supporting frontline providers and clinical resources, and really partnering with community on readiness, response, and relief. That also meant helping to address immediate financial pressures for businesses, for providers, and for our members so that they wouldn't have to make tough choices like whether or not to put food on the table. So, as I think about our workforce, for example, currently more than 95% are still operating remotely with all of our services fully functional. We've removed barriers to care for our members, covering telemedicine costs, but also thinking more broadly about what it meant to access digital care and investing in organizations like PCs for People and more to help close gaps in access to digital equity and related tools. That also meant paying for telephone-only consultations, right, with primary care, general practice with no member cost sharing. Most of my work as Vice President of Community Health and Social Impact was focused on partnering with community organizations. We partnered with over 400 organizations around the region. I mentioned earlier our initiative to distribute personal protective equipment, right? So that individuals that still needed to access care would be able to do so in a very safe environment. We launched a $5 million initiative to distribute 1.6 million units of personal protective equipment to healthcare and social organizations who are at the front lines of the COVID crisis. That meant that we were not thinking just of the large scale organizations, the large hospitals, the large universities. It was really our CEO's intent that we would be that sort of gap filler in ensuring that the little guy, including organizations who were doing food distribution that also needed to be protected and safe, receive that as well. We've also contributed over $4.5 million to community nonprofit organizations, working to do everything from stand-up testing sites to closing gaps in food insecurity. There was a lot of work, for example, in Baltimore and the District of Columbia to support farms and growers who had access to food, but really needed support to ensure that they could get those elements of produce into the hands of communities that need it most. We also thought about our role as a data provider, right? As the largest healthcare insurer, we have lots of data and analytics that can be used to identify communities who are most vulnerable. We partnered, for example, with the Maryland Health Connection to offer a special enrollment period for the uninsured. And I think ultimately, we also tried to think about this work at the intersection of business and mission. So one example I'm really proud of is partnering with Aramark cafeteria staff at 3 CareFirst facilities, right? These were facilities that would have otherwise been empty, individuals who might have had to go home, but we kept them employed. They prepared packaged box meals for distribution, including hot and cold lunches. And to date, we've provided over 40,000 meals. So the last thing I want to say is that, this work is regional, but also national in scope. If we're truly going to transform the ecosystem, we've got to think about how and in what ways are we integrating, as Gita said earlier, how are we integrating that equity focus into core aspects of our business? That means looking at our network solutions, trying to ensure that we can provide transparent reporting on provider performance. That means action to make sure that racial health disparity data is a national priority, and then also addressing health disparities like among clinical conditions like behavioral health, maternal and child care, diabetes, and more.
Thank you. I really appreciate that. Ms. Vikki Walton, you're up next. Novartis is well known and respected in the health and healthcare realms, as you know. What are some of the efforts that Novartis is undertaking to take a lead in making health equity more of a reality during the COVID-19 pandemic?
Yes, thank you for that. And yes, Novartis, we want to continue to maintain that respect and trust. And so we had some immediate responses to health equity during the pandemic. And we first and foremost knew that it was imperative that we work at the community level and start with funds, right? So Novartis made a contribution initially upwards of $40 million to over 60 projects around the world and in the US to support communities impacted by the crisis. And so the donation included strengthening medical infrastructure, providing on-site support. And then we also, through our US Foundation, said we need to do even more. And so we also contributed $5 million to a community response fund, because we believe that it starts in the community when we need to help those who are marginalized. And so that helped with the immediate response and recovery efforts. And then from there, we've mobilized our R&D capabilities like a number of pharmaceutical companies. And we came together and was a part of a multi-stakeholder external consortia to look at how can we look at our medicines, how can we come up with solutions to address this pandemic. And we've been very successful in working together around that and seeing our way out of this. But also, we recognized that there was an increased need for access to our medicines. So we provided free medications during that time. And we also continue to support out-of-pocket costs through copay assistance programs. And so those we saw an increase during the pandemic, and we came in and did what we needed to do to support these patients. But as we start to, again, look at long-term, what can we do to address health equity and what are some of those solutions? Because what's important is we don't want to make sure it's just something we're doing right now. We don't want it to just be a momentary thing. We want to make it a long-term effort to support and address health inequities. And so some of the long-term solutions that we're identifying is lowering out-of-pocket costs for patients, supporting access to telemedicine, telehealth, and then looking at innovative delivery care models that can have a positive impact and create sustainable, healthy communities. And most importantly for Novartis, this pandemic has shown everyone across our organization that we have some challenges across all disease areas, including sickle cell disease, including cardiovascular disease, cancer, even our biosimilars. And there are areas that we need to address when it comes to health equity, and we need to put the resources behind that. Right. And so I'm excited that it's not just looking at it. Again, like I said, 10 years ago, for 10 years, we've just been kind of, we see it, we know it, but now we're putting the resources behind it. And we want to lead in these efforts and have a long-term commitment to ensuring health equity.
Great. Thank you for that. Thank you for that. So last but not least, again, is Portia White. The campaign for tobacco-free kids has long been on the front lines of keeping tobacco out of the hands and lungs of young people. As you know, young people of color have been especially targeted by tobacco companies, leaving them disproportionately more likely to gain access to cigarettes and e-cigarettes. During the COVID-19 pandemic, stress levels have skyrocketed, especially among young people, leaving some young people more susceptible to tobacco use. Is this a concern for your organization? And would you talk about some of your efforts, your organization's efforts to keep tobacco products out of the hands of young people during COVID-19?
Most definitely. This is a concern to the campaign for tobacco-free kids. And this is our 25th year as an organization. And what we have seen is that we have to move forward with our mission. We are doing it with a targeted campaign right now against the tobacco industry and its pernicious attacks against communities of color, youth, and other vulnerable groups disproportionately impacted by tobacco. We have three main pillars, the way that we're doing this. Core pillars are education. We're going to educate the public and build awareness in impacted communities. We're going to engage more organizations with us. We have a good number of base of organizations that we partner with, but we're going to continue to grow that. And then we're going to mobilize those in the community, policy experts, community leaders, key stakeholders to help activate this ground level support for policies and actions. One thing that, and you mentioned the state, the mental state of our youth through this crisis. You're absolutely right. It's been devastated. Actually, on the 28th, which is this Wednesday, right? We are actually going to have a second part of our series. We call it Campaign for the Culture. And this Campaign for the Culture is going to really focus on exactly that. What are the youth saying in their communities? What are they feeling within health disparities as a whole? And, we've done some discussion and had some talks with them, and we actually realized that mental health is huge. It is a huge factor right now with our youth, not only trying to adapt to this new culture that we're in due to COVID-19, but really the fact that they're at home, half of them are at home, homeschooled or doing teleschool as opposed to being back in school, and just adapting to this whole society and the stress is just really huge. Another thing that we did, actually, we had a National Day of Action. We did it on April Fool's Day. So we actually roasted big tobacco, had youth and social media as a key driver to participate in this. And so it was an excellent opportunity for youth to step up. And thirdly, because I want to make sure we have time for our questions as well, I'm just going to briefly say, thirdly, what we've been doing is reaching out specifically to HBCUs. And we're doing that because we're doing a listening tour. We want to hear first what the youth, the older youth are experiencing, and how specifically within the African-American community, the Black community, that we can be much more advantageous in helping them to conquer this tobacco plague is really what I want to call it, because they're doing it in so many different ways, not only with cigarettes, e-cigarettes, hookah, cigars. It's devastating to understand that if we don't stop this now, we will have a generation that will continue to be affected, continue to die from these morbidities that tobacco causes.
Yeah, thank you. Thank you for that. I'm going to open the floor in 1 second because I'm seeing a lot of questions coming in. So I'm excited that this is such a lively conversation. But I do want to ask everybody on the panel one final question, and I'll open it up for the audience that's listening in. For those listening this morning who are wondering, what can I do to get involved in all of your respective efforts? What role can I play? And I always say, one person can't do everything, but everybody can do something. And so what specific action steps would you recommend that an individual take, to join your respective efforts to work toward health equity during these really trying times? I'm going to start off with Dr. Bridges.
Well, I would say that as individuals, to use our rights as citizens, because health equity depends upon the political situation. It is a political question. Social and political run right together. So to the extent that you can reach out to your representatives, reach out to other members of the elected portions of the government, or even people who are in the executional part of the administration, that will have tremendous impact. People listen. And the more we can bring our voices together to address all these issues, the more effective we'll be.
Right. Gita?
Well, I guess I'd say volunteer. Volunteer at your local food bank or your local food pantry. We need the help. We've seen a sharp decline in our volunteer base, and many of them were seniors. So as COVID-19 has presented that increased risk and has really taken away a lot of our vital volunteers. I also would agree with Dr. Bridges that we need to vote. And we also need to take the time to educate ourselves and become our own health equity champions, so that we can continue to shift the power to the community level.
Right. And Gita, just one quick question. For those listening who are interested in volunteering, how do they do that? Is there a place they can go to act? Is there a website they can go to, or what's the best? What would you recommend?
Well, I guess you could call me directly or email me directly. I'll field those requests, but also on our website you can get more information about how to volunteer, feedingamerica.org. Thank you.
Great. Ms. Walton?
Yes, I would say that for those who are participating, and as you're working on different projects or you're involved in different efforts around health equity, be sure, and as you're doing stakeholder mapping, be sure to include the pharmaceutical industry as someone to do outreach with. So if you are looking at who to work with, who to partner with, go on LinkedIn and find us. There are many of us that are working in this health equity space and want to work with new partners and help come with solutions. So I would strongly recommend that you expand your stakeholder mapping and include us in that process.
Great, thank you. Dr. Ramjohn?
I think I'm going to lean on an old adage, nothing about me without me. So much of this ecosystem work requires the engagement of large institutional stakeholders and actors sort of conspiring for health equity success. But we can't do that in ways that compromise resident and lived experiences coming to the table to shape health outcomes better health outcomes and to shape more meaningful interventions. So I think a part of this partnership needs to happen both at the treetops level with bringing folks like healthcare insurers and folks that may not necessarily see their identity in health to create health equity, like financial and lending institutions, like manufacturers and more, those who create vibrant community economic development opportunities and that are so critical to public health. But I think it also means not just treetops, but also grassroots. So what are the ways in which you can mobilize neighborhood associations and senior serving organizations, individuals who are trans and experiencing other identity backgrounds? I think really having a comprehensive lens of creating the right table ensures that we're not planning for interventions at the neighborhood level that leave voices behind.
Great, thank you. And Ms. Portia White.
So I'm going to give you like a threefold piece quickly. First of all, we've got to harness our people power together. That means ensure that policymakers and key tobacco control and public health orgs like those who are listening, just plain old people, are actually out there advocating for change policy-wise. There are two changes that are hopefully taking place soon. There's one that's taking place today. There are new e-cigarette shipping rule laws. It takes effect today, April 26th. So highlight that understanding and praise the lawmakers who are doing those kinds of things. It's a Feinstein-Cornyn bill, actually. It extends current shipping restrictions for tobacco products to e-cigarettes, including age verification requirements. That's big. That'll help youth to stop doing some of those things, get it out of their hands. The other thing is we need to elevate our stories together. And I invite all to email me, pwhite@tobaccofreekids.org. Email me your story. I'd love to elevate your story of how you quit. And for those who need help quitting, because that's really essential, please call 1-800-QUIT-NOW or visit smokefree.gov. That's 1-800-QUIT-NOW or visit smokefree.gov.
Great, thank you so much. All right, so I'm going to open the floor because I've been getting lots of questions that have been coming in. So I know one of them I think was already answered, and this goes to Gita. Somebody asked, is for the volunteers at food banks, is there an age limit?
Not that I know of. I think it's, we see seniors obviously as our volunteers a lot, but we also welcome families. We often that's, sort of a family outing now to actually give back to the community. So children and their parents are very much welcome. I think the best thing to do is to check with your local food bank to see if there are any restrictions, particularly because of the pandemic, but many of our food banks are in need of volunteers.
Okay. And then for Dr. Ramjohn, I just got a couple of questions for you that came in. If an entity was interested in partnering with you, like a public-private partnership, how would they go about doing that around health equity?
That I'm so thrilled. The first is to sort of contact me. I saw that my Twitter was included in the chat. My LinkedIn is just my name, so it should be very easy to find us. Let me tell you a few things about what helps to enhance a sort of successful partnership with CareFirst. The first is a shared commitment to health equity. We've been undertaking quite a bit of work in our philanthropic and related business imperatives to ensure that we are setting new goals and targets around investing in organizations that typically have historically been underinvested in. So we're asking new questions about the demographic composition of a board of an organization or the leadership team, the demographic characteristics of the executive leader, as well as how and in what ways the staff reflect the population that is being served. Again, kind of going back to that lived experiences and centering those components. From a CareFirst lens, we do serve the Mid-Atlantic states primarily from a charitable and philanthropic lens, although our membership is much broader, global even. But that said, I think in addition to the shared values and shared measurement, I think the other component is ensuring that public-private partnership, as I mentioned earlier, is something that creates collective impact, right? So that means that organizations have been partnering together to collaborate and achieve success. And I think the last thing I'll say is failing forward, right? We know that in public health, a lot of these interventions require sustained commitment, sustained investments, and more. But that kind of sustainability means we're able to learn from our mistakes, to publicize them, to ensure that community groups and public-private partnerships can also benefit from our learnings, so we're not still making the same mistakes. The last piece I'll mention is that we have a very significant philanthropic focus on social determinants. So if you're an organization in our region focusing on economic inclusion, small business development, workforce development, educational opportunities, we know learning loss is a huge issue, digital equity, and really the road to recovery. I think vaccine, we haven't talked about vaccines, the V word today, as we think about social determinants of health, but vaccine education and awareness is a huge part of what we are trying to ensure, including purposeful prioritization of disproportionately impacted organizations. So all these create a strong ecosystem for partnership, and I welcome the chance to hear from our audience.
Great, Ms. Walton. Sorry, I'm going to ask you the same question.
Yes, so it's incredibly, I agree with everything that she said. And I think it's important that you do outreach to our industry, meet with people or identify those folks who are focused on health equity, diversity and inclusion. If you have a point person within your organization that is working in those areas, it's imperative that you do outreach to us, because we have come together as an organization and said, this is a priority for us. And in doing so, we need to know who beyond our typical folks that we work with in organizations, beyond that, who can we support and who we can work with. And so I would highly, strongly recommend that you come forward, talk about the work that you're doing, and we can work together on identifying how we can align on those shared priorities.
Right. So should I recommend to people that they reach out to you directly? Because I'm getting
Yes.
asked now for your contact information.
Oh, my contact information. Yes.
I don't want to
Yes, if we can put my email information in the chat room, which is Vikki, VIKKI Walton at Novartis.com.
All right, you're a popular young lady this morning. All right, Dr. Bridges, to you, my question that just came in was around the difficulty that folks have with accessing specialists, especially folks who are newly diagnosed with sickle cell, folks who don't have a medical home, folks who distrust the medical system. What do you recommend in terms of folks leveraging their influence to expand access to specialists in this time of uninsurance, underinsurance, COVID concerns that you mentioned about people not wanting to go into healthcare settings? With your expertise, what are some of the daily steps that folks could take and advocates can recommend folks take to help surmount what seem to many to be unsurmountable barriers?
Yeah, these are all tremendous barriers. I think that, and barrier trust, who can you trust is essential, and that's core to one of the things that we're doing. I think that for many people in the community, one of the best sources of trusted information is through the community-based organizations around sickle cell disease. The Sickle Cell Disease Association of America, which has a very strong advocacy group and has both a medical board, which looks at new therapies, which looks at new interventions. So I would say that if you are having difficulty, one of the best things that can be done is to contact your local advocacy group, and maybe from the Sickle Cell Disease Association of America. There are others as well. And that these individuals who really deal with their lives and have the kind of insight and trust can give very strong recommendations.
And just as a follow-up question, are part of the challenges with accessing specialists, is this just that there's a dearth of specialists available in some communities, especially those that are hardest hit by sickle cell?
That is absolutely correct. The number of specialists, people who work in the sickle cell disease area, are generally with respect to background, very often from hematologists. Hematologists break into two groups, that is hematologists, oncologists. You'll see that often slashed. Should be the other way around. It should be big oncologists, little tiny hematologists, because there are not very many. And the tremendously more lucrative kinds of activities that exist in oncology, you can make a lot of money there. Sickle cell disease, it's really a labor of love. So the number of people who are involved is much less. I think that we can begin to change that around. That's a whole conversation of itself. But I think that that is a key aspect of what we have to do.
Right, thank you. And Ms. White, for you, one of the things that I know for a fact, and because I was on the Hill when this passed, was a lot of the enormous gains gained, probably should have thought about that wording, when the tobacco bill was passed years ago. And there were huge strides made nationally, and your organization was at the helm of just pushing that through. Today, we're seeing some of those gains sort of slide back. And I think for advocates and also for parents who are concerned, you know, what are some of the things that you would recommend folks do to ensure that they're not just relying upon elected officials to ensure something regulatory is happening in their community? What would you recommend that folks do to get really involved, especially during a time where we're seeing uptick in tobacco use and an uptick in e-cigarette use and an uptick in some entities, especially in local communities, you know, selling a pack of Marlboro Lights rather than, you know, $10 for one pack, it's, you know, buy one, get one free kind of stuff that really appeal to young people.
Yeah, there's a lot of things, just really simple things that we can do as parents, grandparents, members of the community, those who might go to your church or sorority, or what we need to do is just, first of all, educate everybody on what these products are. People don't know. I happen to have a 13-year-old, so I know what the products are. And she keeps me keen. She keeps me up on that. But we need to, you know, dig a little bit deeper, ask questions of your youth, those that you care about, and figure out, well, what are they thinking about? What are they using? And what are they feeling? And then helping them to cope with that. One thing that has come out of this is that the mental health perspective is something that is really lacking as far as our nation, as far as supporting in this mental health capacity, mental health issues. So continue to take the stigma off of that, number one. And then number two, I'll just say the one thing that really sticks in my mind that I think helps others to really focus on justice is that health equity quote by Dr. Martin Luther King, which was, of all the forms of inequality, injustice in health is the most shocking and most inhuman. So really take that to light and understand that and kind of dissect it, and understanding that in all kinds of ways, we're looking for health equity, whether that is through policy change or getting involved more in the community or speaking with leaders. There are so many paths that lead to success. I think we've mentioned so much of all of them today, you know, doctors and health insurance, being free in society, and just access to schooling. So I think just educating the population more on the equity and what that really means when it comes to health equity, and then kind of tunneling that then to when it comes to tobacco, when it comes to using e-cigarettes, vaping, or cigarettes as a whole, tobacco products, understand the problems and the detriments that brings to your body, and help people to move away from that.
Right. And it's a follow-up question. We're talking about a population that I feel like they live on social media. And are there opportunities? I mean, my niece is TikToking all the time, and I don't even know what she's talking about. But are there opportunities for folks to partner with your organization to do some creative social media campaigns to really reach young people and to really reach them where they are and in their language?
I'm so glad you asked that. There is. I can't spill the beans yet, but we are actually getting ready to loop horns and hands with folks like TikTok and others to make a bigger spill. But we really would love to elevate the stories, because you're right, it is the social media that's really pointed in this society with young people right now. Forgive me, that's large, that noise outside. But, you know, the cigar manufacturers are doing it. They're targeting on social media and bringing this up to our young people. So we have to speak the same language. You're absolutely right. That's why this campaign for the culture, this focus that we have, is really targeting and using multimedia, all different ways of reaching into youth. We've got a new series that we call Takedown, the Takedown. And on the Takedown, we're elevating voices of youth, partners, or whoever who've had some experiences with tobacco. And that's another way of using this social media as a way to spill it out. So yeah, I welcome that.
Yeah, and I didn't mean to put you on the spot about your Under the Wraps 007 campaign. I just
Yeah, no, they might get me for that one.
So we only have 5 minutes left, so I wanted to hand the floor back to the panelists. And if you guys, all of you, and men and women, or gentlemen and ladies, if you could take just a minute just to sort of share any final thoughts that you have for the folks who have logged on and joined us this morning. And I'm going to start it off with Dr. Bridges.
Well, I would say my big takeaway is that, again, we're talking elements of the same thing. We are speaking really about one language, one thought, and that is the problem of inequity around race and the inequity and the social determinants, which are part of society. Race is a created phenomenon. I think everybody knows that. There is no such thing scientifically or by any other means. And we have to begin to attack the fundamental aspects of this myth that has perpetuated so much inequality, suffering, and injustice over the course of 400 years.
Thank you for that. Ms. Gita?
Yeah, I'll echo that. I was just thinking that, understand this is a journey, have patience is a takeaway that I would say. And for organizations, stick with this. Don't make this a shiny object type of approach. Make this a real commitment and permanent, because we have a lot of undoing to do and we have a lot of learning to do.
Thank you for that. Ms. Walton?
Yes, and I will just reiterate the importance of partnership. We are, as a pharmaceutical company, as an industry, are committed to health equity and disparities, and we have the resources, we have the bandwidth to be a part of that conversation. And so I think it's incredibly important that we are considered as partners in this journey, as indicated, and that it is a long-term journey. It's not, one and done. And so I'm excited to be a part of this, to see change that has long, for years, been overlooked.
Thank you for that. Ms. Portia?
So I'd say for society, for this country, for all the adorable little girls, little boys, black, blue, green, whatever, really, they can be free of addiction of tobacco and the illnesses that occur as a result of the addiction. So let's continue to work together, partner, and speak up.
Great. And Dr. Ramjohn?
Thank you so much. This was a really wonderful conversation. I think in close, I'll say that CareFirst is interested in partnering to drive transformation of the healthcare experience with and for our members in ways that matter, with a focus on quality, equity, affordability, convenience, and access to care. And so what I think is going to really drive, from a business lens, the imperative to achieve equity is this acceleration towards value and towards outcomes, right? CareFirst finds that what is really working is paying doctors for the quality of care they provide, not the quantity. That gives doctors the flexibility to provide what patients need most. And so we look forward to partnering on this journey to value-based care and on this journey further upstream to create healthier communities.
Great, thank you so much. Well, we've stuck to time, so shout out to Ben. And I have to say, I really do thank everyone who joined us this morning, both on this, I'm looking at you guys and people who've logged on, and thank you for the questions. Just as one housekeeping note, for the questions that we did not get to that came in, should we just direct those to the appropriate person to then respond directly to the person who asked? Is that okay with everybody?
That works for me.
All right, I don't want to bombard your inboxes. I got a lot of them. So, all right, we will do that. And just as someone who's been working in the space of health equity for over 20 years, I am beyond inspired to hear from all of you. I'm humbled and quite frankly feel very lazy listening to all the work that you were doing on the ground. But I think that we are in such a great moment to just to really move the needle so far in the right direction on so many different levels. And I am very excited for the day that we discuss health equity as a problem that we used to have in this country. And I think with a lot of your efforts with leaders like you on the front lines, I think that we are marching toward that. So thank you for what you're doing. And thank you for joining this panel this morning. And please stay safe, everybody.